That leads us to diabetes. Okay, diabetes. When it comes to diabetes, I'm just talking about diabetes mellitus. There's a few different types of diabetes out there, but this is really the major one that would make a good essay question on an exam. When it comes to diabetes, it's basically an inability to utilize glucose properly. That's what it ultimately is. But it also leads to weirdness in fat metabolism. It can lead to weirdness in protein metabolism as well, where it either will hinder or enhance the body's breakdown of structure. So, and we'll look at that as we start looking at what these two things are. What is diabetes? It's high blood sugar levels. Okay, that it's hyperglycemia. Okay, hyper means elevated. Okay. Emia means blood. And this is glucose. Okay. Elevated glucose in the blood, hyperglycemia. Okay. This is the primary sign of the disease. What's the disease? Diabetes mellitus. Okay. And over time, this can cause pretty severe damage to organ systems. What are some of the signs and symptoms? I have some highlighted here. Those are probably the biggest ones. Those are the ones that most everybody knows of. So if I was to ask for signs and symptoms, like a multiple choice type question, those would probably more than likely the distractors that you would potentially be choosing from. Okay. Elevated blood glucose levels. It's hyperglycemia. That's what diabetes is. Excessive thirst, frequent urination, increased appetite. Again, your body's not effectively handling the carbs. And cells need energy, okay? And if you're not getting glucose in to make energy, they're going to start breaking down structures. They're going to start breaking down proteins. They're going to start breaking down fat, all right? You're going to feel hungry. It's going to stimulate your brain to go find food, okay? But as you can kind of see there, I mean, good Lord, there's a whole bunch of symptoms, okay? It can cause impotence. It's not good, just in males, not in females. Sores that don't heal. Again, you're not making structures to repair. Blurry vision, foot pain, abdominal pain. You have issues with nervous input going into various different regions. Distal portions, you start losing sensations in those, okay? Numbness and tingling. Okay, again, blood vessels are being affected there. They're not effectively delivering oxygen, nutrients to tissues. That's why, especially with the elderly, with their Medicare programs, they have a yearly screening for diabetes where they go in and have their feet checked. You just don't feel it. And they can go black and they can lose appendages pretty easy. Especially in the elderly there. Confusion, I mean, that's okay. Confusion can be a lot of different things. Fatigues easily. Again, you're not effectively getting anything in to the cells to make energy, stimulates the body to try to go find food. But breath that smells like fruit, this is your ketones, okay? This is ketones. All those excessive ketones, the body tries to get rid of. One of them is exhale, and that's the telltale sign of diabetes, to be honest. I'm not going to ask you the number of here, but you can kind of see from 1980 to 2012, when they last had information for this, you can kind of see, I mean, holy smokes, this is a pretty substantial rise. It's the 7th leading cause of death in the United States alone, diabetes is. Okay. Again, we have two types of diabetes, type 1 and type 2. Type 1 is autoimmune. Okay. The body attacks the cells. That's what that means. Okay. With type 1 diabetes, there's as you can kind of see, it's kind of a genetic thing. Okay. There may be some viral infections that can happen. Last semester, somebody was I had a student who was in a severe car wreck. And they had some pretty substantial abdominal damage. And it threw her into basically this type of diabetes, but it's usually a genetic thing. Okay. Autoimmune diseases are generally genetic in nature, right? But there can be some other things as well. Environmental factors, exposure to environmental toxins, viral infection. There are a few other things, but generally it's a genetic thing where you're not born with a specific amount of beta cells at all, or your body destroys them for whatever reason, don't know why. Okay. For these type of individuals, must be supplied with a shot. Okay, that's what exogenous source means. Exogenous means outside the body. Outside body. Okay, that's what that means. So these people have to have it through a shot, which is different from type 2. Type 2 diabetes is the most common form of diabetes. And when I say diabetes, diabetes mellitus, I'm just shorthanded at diabetes. Okay. Most common type. Again, this one, beta cells are there. Okay. And as you can read there, beta cells are producing the insulin. Okay. But target cells are becoming insulin resistant. Okay. There's so much sugar within the blood, the cells are like, dude, I don't need this. There's so much. And these beta cells are pumping out a ton of insulin to the point where cells become deaf to it. And so now beta cells are like, okay, well, the last few times I had to dump out X amount of insulin. And the next time you eat, let's say you have a lot of high carbs again, very simple carbs that you're consuming. And so you get a huge influx of glucose. So now the beta cells are going to be like, oh my God, I got to pump out all this insulin. If we do this over time, 5 years, 10 years, let's say you ate a lot of simple carbs for the first 20 years of your life, that's a long time. Okay. What happens to these cells over time? They start to get burnt out. They start to get burnt out. These individuals potentially will need insulin, some kind of insulin injection. Okay? But the vast majority of these type of cases with type 2 can be handled with diet correction and exercise. And that's as simple as it gets. Those most susceptible for this are those that are obviously overweight because they're consuming, generally they eat a lot of carbs, not expending any energy. But for a lot of people, it is genetic. Okay, so if you have a very close family member with type 2 diabetes, the chances of you becoming a diabetic are pretty high. Okay, especially if it's a first degree, especially if it's like a parent. The last type of diabetes that I really have listed in here that I'm going to ask on the exam is gestational diabetes. Gestational diabetes is a specific diabetes that happens only when a woman is pregnant. And obviously this is only going to be for a woman. This is not for the man. Okay? This is just a type of diabetes that develops in women during pregnancy. And we'll look at this again a little bit later in the semester when we look at life stages, when we look at pregnancy. Okay. Why is gestational diabetes bad? The development of birth defects. Okay. This can really affect the development in utero, and this can really do a lot of other things as well that we'll talk about more at the end of the semester, but this can lead to a lot of potential chronic health conditions in the little babushka. Okay. For mom, looking at mom, it can cause high blood pressure, which is preeclampsia. You have preeclampsia and eclampsia. Preeclampsia usually begins about 20 weeks pregnant. especially when prior to that it's been normal, then all of a sudden she has high blood pressure. That again usually starts about 20 weeks. That's a telltale sign for gestational diabetes. Um, Along with that, there's also some kidney issues. It can lead to liver issues, some heart issues. If uncontrolled, it can go to eclampsia and cause death. We'll talk about it when we look at life cycles, when we look at pregnancy. It can result in a larger birth weight of a baby. With a larger birth weight of a baby, we have potential complications during the birthing process, which obviously can cause harm to the little baby. More prone to undergo cesarean sections, a C-section. Again, we'll talk about a little bit more later in the semester, but having a vaginal birth really is important. Having a vaginal birth is really one of the first chances for the child to get that introduction of bacteria that's going to seed that large intestine. And there's studies to show that those that are born through a cesarean section have a different bacterial species profile there in the large intestine than those that are not. And that can help with the longevity of prevention of chronic in children. So a pretty important concept in the grand scheme of things.